I am Kemoya Stevenson and I will be focusing on the topic, what are arterial blood gases? Arterial blood gas is also known as an ABG. This test measures the acidity, pH, and the levels of oxygen and carbon dioxide in the blood from an artery. It is used to find out how well your lungs are able to move oxygen into the blood and remove carbon dioxide from the blood. ABGs are drawn for a variety of reasons. These may include concern for COVID-19, lung failure, kidney failure, shock, trauma, uncontrolled diabetes, asthma, chronic obstructive pulmonary disease, hemorrhage, drug overdose, metabolic disease, and chemical poisoning. There are 6 key components to an ABG. They include pH, partial pressure of oxygen, partial pressure of carbon dioxide, bicarbonate, oxygen saturation, and oxygen content.
Hello, my name is Shamil and today I'll be demonstrating the arterial blood gas test, how it is done.
Now I wash my hands, have to ensure my hand is clean before attending to the patient.
Good afternoon, my name is Miss Morris and I've seen where the doctor requested for you to do the arterial blood gases test. But before we do it, I just want to ask you a few questions.
No problem.
Okay, so your name is Miss Samantha. Alright.
Yes.
So just going to check your hands to see if there are any implications and you'll see your hand is fine. Alright?
Okay.
So it's not a painful procedure, so just relax. So just make a tight fist. I'm just going to press down on area. Right. You can release the fist now. Good. Let me do it one more time. It's just to demonstrate that the oxygen level is flowing to your artery. Right. Just going to press down on it. Can release. Good. So the blood flow is now flowing back to your fingers. So it shows that your oxygen level are okay. These are my equipments: the alcohol swab, the syringe, and the ABG needle, and the gauze. So I'm just going to clean the area. Needle is inserted at 45 degrees angle. Right. Just apply pressure to the area. Should listen.
It's very hard.
Needle drop in a sharp container. Shampoo's in the middle. for today. The process is finished and you will get back your results as soon as possible.
Thank you, it was so easy.
Thank you so much.
Handling of samples. It is important that immediately after blood sample is collected, that the air bubbles within the sample is expelled, because if an air bubble whose relative volume is up to 1% of blood in syringe, this may cause a serious effect on the partial pressure of oxygen, and this can cause inaccurate results. So to prevent this, the following can be done. First, hold the syringe vertically and gently tap the syringe so that the air bubbles is forced to the top of the syringe. Then you expel the air bubbles into the filter cap of the syringe, after which you mix the sample by thoroughly rotating your wrist back and forth in order to dissolve the heparin and to minimize clot formation. After this is done, you roll the syringe between your hands for about 10 times, and after this is done, you remove the cap from the syringe and expel the first few drops of blood into a gauze pad. After you have done this, you will now place the sample into the analyzer for it to be tested. I must note that blood samples are stored for up to 30 minutes at room temperature. If there is a delay for more than 30 minutes, it is recommended that glass syringes and an ice slurry is used.
Effects of severe anemia on oxygen saturation. The effect of severe anemia on oxygen saturation is that it may decrease the delivery of oxygen and increase the oxygen extraction, which may lead to decreased venous hemoglobin saturation and lower tissue oxygen saturation. Effects of high altitude on oxygen saturation. The effect of high altitude on oxygen saturation is that it lowers oxygen saturation levels or causes desaturation of individuals' blood. This may occur due to the low atmosphere pressure at high altitudes. Effects of carbon monoxide on oxygen saturation. The effect that carbon monoxide has on oxygen saturation is that it forms carboxyhemoglobin and results in impaired oxygen transport and utilization.
My name is Danielle Mitchell, and I'll be doing an interpretation of results for ABG tests. Firstly, if the ABG results reveal that the number of pH are not within the normal range, the patient's pH levels is either acidic or alkalic. The lower the numbers of pH, the more acidic a patient is. For instance, a pH of 3 is severe acidic and requires emergency intervention. The number of pH of blood ranges from 7.35 to 7.45. If the pH level is less than 7.35, it will be categorized as acidosis, and pH greater than 7.45 would be categorized as alkalosis. Partial pressure of carbon dioxide would be between 75 to 100 mmHg. Partial pressure of oxygen would be 35 to 45 mmHg. Oxygen saturation would be 94 to 100%, and bicarbonate would be 22 to 26 mmHg.
Focusing on the topic, total carbon dioxide. Total carbon dioxide can be described as the sum of all forms of carbon dioxide in the blood. However, it is not measured during the blood gas analysis. Carbon dioxide is a product of aerobic cell metabolism. It is transported in the blood to the lungs for excretion in expired air. Total carbon dioxide in arterial blood gases. The normal content of carbon dioxide is maintained by homeostatic mechanisms. Homeostatic mechanisms are distributed in a range of respiratory and metabolic diseases.
Arterial oxygen saturation is measured with a pulse oximeter. It is a small device attached to your finger or earlobe. It allows light to pass through your fingertip or earlobe, and that determines the amount of oxygen in the blood. Arterial oxygen saturation estimates oxygenation, which is the addition of oxygen to a bodily system, but it does not provide information about the respiratory ventilation. Respiratory ventilation is the exchange of gases between the lungs and the atmosphere. A small drop in arterial oxygen saturation indicates a large drop in the partial pressure of oxygen. Enhanced ventilation lowers the partial pressure of carbon dioxide, which causes respiratory alkalosis, which is low carbon dioxide levels in the body and the blood becomes too alkaline or basic. Reducing ventilation increases the partial pressure of carbon dioxide and causes respiratory acidosis. That is when the body cannot get rid of all the carbon dioxide it produces and the blood becomes too acidic.
ABG is a test done to measure the acidity and the levels of oxygen and carbon dioxide in the blood from the artery. In ABG, there are 4 important components. Those are your pH, your PaCO2, meaning your partial pressure of carbon dioxide, your HCO3, meaning your bicarbonate, and you have your PaO2, meaning your partial pressure of oxygen. Now, narrowing down on the partial pressure of carbon dioxide, the more carbon dioxide you have in your blood, the more acidic your blood is. Now, in ABG, there is a set range for the 4 components. There is a range that should not be passed. Further down, I will show you the ranges. For pH, it should not pass 7.35 and 7.45. However, now focusing on carbon dioxide, the range for carbon dioxide is 35 and 45 mm mercury. However, if the test is done and the results show that it is more than 45 mm, it is more than 45 mm mercury, this states that your blood is acidic. It is on the acidic side of the scale. However, if the test is done and it is below, if it is 35 or if it is 35 or below 35, it is said to be basic. But when I said acidic, when I said if it is more than 45 and that it is acidic, it doesn't mean that CO2 is acidic, because CO2 is not acidic, but the amount of CO2 is directly proportional to the number of hydrogen carbon being produced, which is related to an acid, right? So I'm going to show you the range for the different components. Right, so for pH of blood, it should be 7.35 to 7.45. Partial pressure of oxygen, PaO2, 75 to 100 mm Hg. For partial pressure of carbon dioxide, it should be 35 to 45 mm Hg. For oxygen saturation, it should be O2. It should be O2. Or for O2, it should be 94 to 100%. So bicarbonate, it should be 22 to 26 mm. 22 to 26 MEQL. Now, the higher the partial pressure in an area, this typically means the higher the amount of gas that is present within the area. Repeat. The higher the partial pressure in an area typically means the higher the amount of gas that is in the area. Right.
ABG test, the Arterial blood gas test. Say you have short of breath, an ABG test is the best. Measurement of acidity or alkalinity from an artery. No fasting test. So eat your food and digest. Preparation of patient. Make sure to perform the alliance test. Ask if patient is on medication so during the process nothing goes wrong. How test is done. Prepare all equipments needed like the gauze, gloves and tape, alcohol wipes and ABG needle. Remember to wash your hand and put on your gloves. Proceed to palpate radial pulse. Clean sides and allow it to dry. Remove protective cover from ABG needle and flush through heparin from the syringe. Then go ahead and insert the needle at a 45-degree angle. Now, observe the flashback as blood flows into syringe just like that. Then, remove the needle, apply pressure to puncture site with some gauze. Yes, that's right. Engage needle, safety guard, then remove the needle and discard. Handling of the sample. Remove air bubbles from the blood in syringe. Test blood samples immediately so results are given accurately. Samples can be stored up to 30 minutes at room temperature. That's the limit. Interpretation of the results. Normal ranges is the guide by the raw method. You shall abide. Low pH is acidosis while a high pH is alkalosis. Significance of health and illness. ABG test checks for COVID-19 and asthma, cystic fibrosis and COPD. ABG test, the Arterial blood gas test.